Thank you. Hi, everyone. I am Daphne Alcial, Policy Strategist at the National Association for Family Childcare. Thank you all for joining us tonight for this conversation on benefits, stability, and the future of family childcare. We're excited to have several partners joining us tonight and bringing their individual expertise to this conversation. So I'm going to start by introducing them before we dive into the content. Tonight's discussion will be supported by several team members at NAFCC, including Erica Phillips, Executive Director, Francia Wisniewski, Director of Membership and Community Engagement, and myself. And then we're also very excited to welcome several of our partners. Mario Cardona is a partner at Education Council, a mission-based practice within the Nelson Mullins law firm, dedicated to advancing equity of opportunity for all learners. And previously, Mario served as a senior education advisor at the White House Domestic Policy Council for President Obama and President Biden. Marissa Schleiber is an assistant research professor at Erickson Institute and the associate director of home-based childcare research for the Center of Home-Based Childcare Research. In these roles, she designs and conducts research with a focus on home-based childcare research and policy. Jessica Magdaleno is an early childhood educator with over 25 years of experience serving children and families in California. She is the founder and director of the Childcare Business Institute and founder of Mamash Curriculo, empowering early childhood educators through business training, leadership, advocacy, and educational resources. Thank you all for joining us tonight. Before we get into the content that the experts have, we felt it was important to ground ourselves in the current federal policy landscape. So we're going to discuss the state of affairs. Across Congress and federal agencies, we are seeing growing recognition that home-based childcare is critical to meeting the needs of families, particularly in rural communities where other forms of childcare may not reach. At the same time, we're seeing policy debates that could either strengthen or destabilize the future of family childcare, depending on how these decisions are being made. So over the past several weeks, as it has all year, things are moving quickly. A lot has happened. And I'm going to review this quickly, this briefly, so we can get into the content of tonight's agenda. But you can review all of this information and more details and links to each of these bills in our May policy bulletin, which the link is being shared in the chat. So feel free to check that out. So Congress has advanced bipartisan legislation that reflects both the opportunities and tensions that are shaping our sector. The House unanimously passed the SEED Act, which would allow early childhood educators access to the same educator expense tax deduction that is available to K-12 teachers. And while this might be a small acknowledgement, it is an acknowledgement that what you all do as childcare educators is skilled professional work that is deserving of recognition. We've also seen the movement of some rural childcare legislation to the Farm Bill package, which leverages USDA programs to expand childcare access in agricultural and rural communities. But with these opportunities also come some concerns. So broader Farm Bill provisions could reduce nutrition support for children and families, which would directly impact the well-being of communities that you serve every day. And then you'll also see the CCDF, the Child Care and Development Fund final rule has been released, and it rolls back several 2024 federal payment protections, which included enrollment-based payments, prospective payments, and the 7% copay cap for families. So while states can still choose to continue policies like prospective and enrollment-based payments, they're no longer federally required to do so. So that means that the advocacy goes to the states and goes to you all. And so we've developed talking points and some resources to help getting that conversation started at the state level, and a link that is included in the policy bulletin, and you can find it there. And yet, despite all of this uncertainty, family childcare continues to show strength and leadership. Across the country, you all are continuing to sustain care for children and families, even despite decades of underinvestment. And it's surviving because you have built programs deeply rooted in relationships, cultural responsiveness, and community trust. And that is why conversations like the one we're having right now tonight matter so much, because the future of family childcare cannot simply be about preserving what currently exists. It has to be about policies that recognize you as human beings, first and foremost, and family childcare as the essential infrastructure that it is. So once again, thank you all for being here. Thank you for your advocacy and for the work that you do every day. And without further delay, I'm going to turn it over to NAFCC's Executive Director, Erica Phillips, to lay the groundwork for our time together tonight. So thank you all. Erica?
Good evening, everyone. My name is Erica Phillips. I'm the Executive Director of the National Association for Family Childcare. Thank you, Daphne, so much for sharing that landscape of where we're at federally and also for the research and intention that both you and our other NAFCC policy leader, Ebony Delaney, put into today's session. It is my true honor to be able to serve all of you, our members, our supporters, our uh, partners in working at the National Association for Family Childcare. And I am so grateful for everybody who joined us today. I know many of us have had really, really long days. It's 8 p.m. on the East Coast. Some family child care educators are probably just seeing off their last children, yet you still showed up. There are so many other things you could be doing. So I don't take that for granted. One last thing, especially for my New Yorkers. Wow, it's 4 p.m. in Alaska. Thank you for joining. One last thing I have to say, especially for my New Yorkers, go Knicks. All right, few basketball references that will pop in. Um, but today we are here to talk about family childcare and access to benefits. The fact that we had over 300 people registered for this webinar, there's over 125 of us who are here today, and we know many more people will access the recording afterwards, tells us that this is something that is very important. This issue is deeply felt across the family child care field. And people are looking for answers, for support, and for pathways forward because the current reality is not sustainable for so many educators. One of the things that I hear consistently when I'm traveling around the country, when I'm meeting on Zoom or having a phone call or receiving a text is how much you love the work, how much they love the work, but the love for children, the families, the relationships that are built into the community is should not require personal sacrifice at the level that we're seeing across the field. It's unacceptable that so many family child care educators who are professionals, you're educating young children, you're supporting families, you're running small businesses, you're holding together entire communities, yet do not have access to basic benefits like affordable health insurance, retirement savings, paid time off, or the financial stability, despite working, we know, 50, 60, 70 hours a week. And if you're struggling with those issues, I'm here to say today, you're not alone. We do an annual survey for family child care educators. In our recent survey, the top challenges identified were retirement, access to paid time off, health insurance, maintaining full enrollment, and the overall business and financial sustainability of your family child care program. These findings reflect what we experience every single day. that the stress of trying to educate and care for little ones while not being able to fully care for yourself or your own family is weighing on all of us. One person wrote, childcare professionals need a living wage, retirement, and affordable health care plans to take care of ourselves. And that's simple, but very powerful. It's not a luxury. This conversation is not about a luxury. It's about sustainability. It's about dignity and respect, and whether or not we are able to value the work that is happening in family childcare programs across the country. So at NAFCC, this is a huge priority for us. We believe that this has to change, and it's not just a side conversation in our work. If we go on to the next slide, we'll talk a little bit more about some of the things that we're doing, but I just wanted to share that this is truly embedded throughout all of our work. We're working across every organizational lever that we have: advocacy, policy, partnerships, policy, our membership, in order to create pathways towards business and personal prosperity. This webinar is one of those things that we do. We also, at the end of the webinar, are going to be talking about a new retirement benefit, as well as some other benefits that we have that people may not know, which include dental, travel discounts, and a health insurance navigator. We're thinking about benefits and really self-care when we think about quality and accreditation. And what does it mean to have self-care as an indicator of quality? Because we do know that educator well-being impacts the experience for young children. We're thinking about this across our advocacy and making sure that you have resources to advocate on the local level with your state for better support and inclusion. And we are also advancing and ensuring that there are policy changes too. It's one of our policy priorities is increasing compensation for family child care educators, including benefits. That's why we collect data. We have a new report that we're putting out that hopefully will be useful to you and your advocacy. Our team is working on legislation. There's one that we're working on right now related to liability insurance. And we're just making sure that family child care and the specific needs of the family child care businesses are represented in all of the national coalitions that we are a part of. So please share any feedback. We are open to supporting in any way that we can. We're responsive. But just we want to make sure that it does require all of us to work together to advocate, to push for a future where we all, family and family child care educators, have the same access to economic security and professional supports that so many in other sectors take for granted. So my hope for today is that you leave with some practical information, but also with something just as important, that your experiences are valid, that this issue matters, and that there's a growing movement to change these conditions. So thank you for being here, for the work that you do every day, and for continuing to raise your voice on behalf of yourself, your peers, children, families, and the future of family childcare. So I am excited to introduce a partner and a friend of ours, Marissa Schleiber from the Erickson Institute. She has done a lot of research on benefits for home-based childcare educators, and she's going to share that with us. So thank you, Marissa, for being here.
Yes, thank you, Erica. So good evening, everyone. So I'm going to walk us through some data on family childcare educators and their access to benefits. So despite their important role, early educators have historically received low wages, with family childcare educators often receiving the lowest wages across the sector and often with limited access to benefits. So while there is often less data on family childcare educators and benefits compared to those in center-based programs, available data suggests that many do not have access to these essential supports. So regarding health insurance, many are small business owners who are self-employed and often do not have access to employer-sponsored health coverage. Family childcare educators either have to purchase out of their own earnings, which can be difficult, especially as many operate on razor thin margins, or instead have to look at other sources. So, for example, in a recent analysis of nationally representative data from the 2024 National Survey of Early Care and Education, about 1 in 4, so about 24% of educators, family childcare educators, obtained their health insurance through public sources, so Medicaid or Medicare. And another 1 in 4, so about 26%, obtained their insurance through a spouse. So while most of the sample had some form of health insurance, 10% were uninsured. And this mirrors what we see in our research as well. In this same analysis, slightly more than half, so 53%, reported that they had paid vacation or summer or holiday breaks, and less than half, so 43%, reported having paid sick leave. So in our studies as well, we find that this is a big issue. So educators not being able to take time off or paid time off to attend to their needs or their family's needs and not lose revenue. Lastly, data suggests that retirement is also a challenge and that many family childcare educators are not able to save for their financial future. So, in a study of family childcare educators in California from a few years ago, 21%, or about 1 in 5, reported having any retirement savings. So, access to benefits is an essential support, and research has documented the consequences when educators are not adequately compensated. So, this exacerbates burnout and stress, undermines their well being, and also their intention to stay in the profession. Surveys of educators across the country have indicated material and economic hardship, so really difficulty paying routine living expenses like housing, utilities, food, health insurance costs, for example. And a few years ago, our team conducted a study called the Multi-State Study of Family Childcare Supply and Decline to understand the pathways of family childcare educators, including their reasons for departure from the profession. So among 30 former educators, so this was a small qualitative study, challenging working conditions and lack of benefits were factors contributing to their burnout and exit from the field. Specifically, 2/3 reported challenges around the economics of family childcare, so low child enrollment to support a sustainable income and a lack of access to benefits. So benefits like health insurance, paid time off, and retirement. And many also describe moving from family childcare to a job with more stability where they could secure a higher income or benefits, either in the EC's early care and education sector or outside. So I have a quote on the slide from the study from a former provider who left to take a corporate job outside of childcare, who really emphasized that it was hard to make it on her own without having additional support to be able to cover gaps in income, especially when enrollment would fluctuate, or to rely on someone else or having someone else to rely on to access health insurance or retirement, which has also been echoed in a lot of our work as well. So before I end, last year, our Center for Home-Based Child Care research team conducted a policy scan and tracked local and state economic support strategies, especially those that were focused on family childcare. And we saw that there is a lot of innovation out there for prioritizing educators and their economic well-being. And I know that tonight our panel will dig into more of these policies and initiatives. So with that, I will hand it back over to our panel.
Thank you, Marissa. Appreciate the pairing qualitative with quantitative data there. Thank you for telling stories. And we are now going to pass it to Mario to talk through some challenges around Medicaid and family child care.
Thanks so much, Daphne, and thanks for having me. Good evening, buenas tardes. Again, my name is Mario Cardona, partner at Education Council. It's really good to be with all of you. Thank you for having me. I'm an attorney by training, and I work at a law firm. And at the same time, what I'm providing is not legal advice. It is for informational purposes only, and so please take it in that way. And so what I wanted to do was spend a few minutes talking about some big changes that happened recently with the Medicaid program. And there were changes that Congress made last year and the president signed into law. and those changes will be implemented fairly soon. And so I'll provide a summary of what some of those changes are, some considerations that are specific for family childcare. And then I know that the team here at NAFCC is developing a lot of great resources for you all to help navigate all the different things that are in front of you to help wrestle with these policy changes. So just to take a step back, last July, Congress passed HR 1, the One Big Beautiful Bill Act, which made two significant changes to Medicaid for adults ages 19 to 64 in Medicaid expansion states. So it's those states that have expanded Medicaid to nearly all adults with incomes up to 138% of the federal poverty level. And those changes include that states must now verify eligibility every 6 months instead of annually for those adults. Adults must document at least 80 hours per month of work or qualifying activity to maintain coverage. And both of those requirements take effect in January of 2027, though some states are implementing them earlier. Both of these changes apply to the same population, expansion adults in the expansion states. And something to consider with respect to the 6-month redetermination is that, again, it'll require eligibility redetermination every 2 years. So people are going to have to prepare for that on a biannual basis. And then for the work requirements, just to dig in a little bit deeper into some of the details, it's going to require documentation of 80 hours of work per month or proof of at least $580 in income. The hours and the income are two different paths to compliance. So if one is difficult to document in a given month, the other may still qualify you. And then there are also specific exemptions that exist specifically for the work requirement piece. And so those exemptions include those who are primary caregivers of dependent children or people with disabilities, or pregnant individuals, and those enrolled in school at least half time. And so, these changes are coming, as I mentioned before. And so one of the things to consider is that documentation around this is going to become very important. And that we all know that family child care providers derive income from lots of different sources. It could be subsidies, it could be private pay, it could be food program reimbursements. And so what the state takes as qualifying documentation is something really that folks are going to have to consider. And so I'd encourage you to monitor how states are tackling this and implementing this, and what they will take as qualifying documentation. Also, too, as we know, there could be fluctuations in family child care income. There could be enrollment gaps. There can be late subsidy payments, seasonal dips that are common. And since most family child care providers, as we know, are self-employed, it can be really difficult verifying income potentially in formats that states accept. And so, again, really important to monitor what's happening in the states, how they're going through this, and of course, take a look at the great resources that NAFCC prepares and others. I know a lot of this is not positive news, and I know that it makes it more difficult for individuals to gain access to really critical benefits that people need. And a major concern is that people who are still fully compliant may lose coverage because there could be missed deadlines, there could be procedural confusion, all these different things. And so that's why it's going to be really important for everyone to be talking with one another. You should be, again, thinking about what's happening in the states. Get access to experts, and NACC is really great at this too. But the benefit is that we're having these conversations now ahead of January of 2027 when many of these changes are going to take place. And so I just wanted to say again, a lot of people are working hard to think about different ways to make implementation less burdensome and to mitigate any sort of impacts. This is work that my colleagues and I are doing in partnership with a lot of other people because we know how critical access to Medicaid and other aspects of the social safety net are for communities across the country. And so what I wanted to say is that we're with you, and we're going to do our best to make sure that people get access to the information that they need. And so with that, I think I'll turn it back over to Daphne.
Thank you, Mario. All right. And now we are going to move into a panel discussion so that we can ask some more questions about some of the things you've shared. I'm going to bring Jessica and Erica and Francia onto the stage with us. So everyone is here. And for the audience, if you all have questions based off of the information that you just heard or others, we'll try our best to answer it. So please feel free to put that in the Q&A, and we will try to answer as many as we have time to do so. And I'm going to get us started with a few questions, just maybe that'll get your mind going. So the first question I have for Mario is, what do you believe is the biggest misconception that policymakers have about how family childcare educators access benefits?
So, thanks for the question. I think there are a lot of misconceptions around how easy they believe it might be to access benefits. And so, again, I think one of the things that'll be really important for everyone to be doing is describing the burdens that some of these new requirements create for communities across the country. And so, if the goal really is to make sure that people can maintain access to subsidies or to benefits rather that they're eligible for, it's going to be really important to communicate the specific circumstances under which family child care providers operate. And so I was talking to them about, a little bit before, but I think sometimes people don't understand the really complex nature of this work and how it's compensated. So I think communicating all those different things to state officials and to federal officials is critically important. And the last thing that I'll say is that sometimes too, I think family child care providers may believe that they can't engage in advocacy of any kind, or that people won't want to listen to them. I sat in policymaking seats for over a decade, and I'll tell you that the best information that I ever got was from parents and providers, and leaders like Erica and Daphne and Yezi and Ebony, who represented you really, really exceptionally well. And so, to the extent that you ever have time to engage in that kind of advocacy or awareness raising, I would encourage you to do it.
We did not pay him to say that, just, by the way. Yes, agree. The stories are so powerful. So thank you for highlighting that. All right. Next question I have is for Marissa. Marissa, looking at the research side of this conversation, where do you feel like the research points to solutions that are being overlooked or perhaps underutilized?
Yeah, thank you. So that's a great question. So access to benefits, as we see, is an essential support for educators. And as I mentioned before, research has documented that benefits are a challenge for many family childcare educators and suggests that when they're not adequately supported, it can increase burnout and stress, undermines well-being, and their intention to stay in the profession. So given the research, I think it points to solutions that really focus on and prioritize educators' financial security, their health, and their well-being. And we're currently seeing some innovation out there around solutions that are prioritizing economic well-being and that are really including family childcare educators who have historically been overlooked in policies and initiatives. So as I mentioned, before, last year, our Center for Home-Based Childcare Research team conducted a policy scan of economic support strategies across states and localities to see what initiatives are offered and how family childcare educators are being included. And we produced a brief with just some illustrative examples. A lot of the solutions that we found largely focused on wage initiatives, so direct payment to providers, tax credits, and a few on benefits, which we know is so important. So there have been some preliminary evaluation and research into some of these initiatives that have really shown positive impacts. So strengthening retention efforts, increasing morale and satisfaction, reduced stress, and overall improved economic well-being, which is promising. And there are also other strategies that have emerged for supporting economic well-being and also supporting educators and their families. So for example, childcare assistance for educators' own families, especially as many have young children themselves, or grants towards facilities or program operations to help offset their costs. So seeing initiatives around housing, so helping family childcare educators with housing costs, so direct grants maybe to cover down payments, property taxes, home modifications. and also just paid time off too. So solutions that really prioritize substitute pools, expanding sick leave, helping educators or family childcare educators build into their contracts with family and into their model paid time off. So I think too, when we look at research and what has shown to be promising, I think research has pointed to networks as a promising solution for supporting FCC educators, and our team has done a lot of work around networks. And one way that it's been particularly helpful is around business practice support. So I think networks also have the potential for helping educators access and understand what is available to them. And I think too, we're seeing the development of cost models that are really tailored for family childcare settings that reflect the true cost of delivering high quality care as another solution. So these often will build in compensation, wages, and benefits. This can help states kind of better align funding with the full cost of offering childcare to ensure sustainability. And oftentimes too, these models, should look to family childcare educators to inform. So the assumptions and the factors are really grounded in their lived experiences. So I will just say lastly, in research, from a research perspective, like overall developing solutions that are really informed by educators and their lived experiences, engaging educators in the design so that systems can be built that reflect and are responsive to their needs.
Yes, +1 to that. There's a question for you, Marissa, before we move on to Jessica, but do you have the link to the report that you can put in the chat?
Yes, to the policy scan, yes, I can put that in the chat.
Wonderful, thank you. And then there was another question that was asking about, in order for you to qualify, do you have to have a certain income? And I am not sure if that question was related to what you were discussing, Marissa, or if that was related to Medicaid eligibility. So we might want some clarification on that first.
I don't
Yes,
know if you have
Erica?
clarification, but I would love maybe for Marissa if there are any thoughts on in order to qualify, you have to have a certain income. What I would say is we're talking about many different benefit programs generally. Some of them you do have to have a certain income. However, what we're advocating for is by nature of you being in this profession, by having a family child care program, regardless of what your income is, you're eligible for these benefits. That is not always the case. That's the messages that we have to inform policymakers, but that is, what we're trying to do. But Marissa and Mario, if you want to add on to that question, would be great.
Yes, no, I agree 100%, Erica. So definitely, I think what we advocate for too, and from a research perspective, is making sure that family childcare educators have access to these benefits. So definitely echoing what Erica just said. So thank you.
And to the extent it relates to any of the things that I mentioned in terms of Medicaid, for the work requirement component, I did mention that there was a few different ways of meeting that work requirement. So there was like either a demonstration of 80 hours of work a month or earnings of $580 of income. There's a good report that our colleagues from the Georgetown Center for Children and Families have put together. I will drop that in the chat, or our colleagues here among the hosts can do it. I think I may have just sent that to the hosts and panelists, but my hope is they can share that with you all in case it's helpful.
Wonderful, thank you. Yes, we'll make sure that it gets in the chat and that it is in the follow-up email that comes out after this as well, so that everyone has access to all of those links. So Jessica is going to share with us a little bit about her experience. So Marissa talked about, several different models that we're seeing across states and localities. And Jessica is an example of what is happening in California through a union structure. And so, Jessica, you have access to benefits through a union structure, which many family child care educators do not. Can you talk to us about what difference that access has made in your day-to-day stability and long-term planning?
Yes, of course, I can tell you a little bit about it. I was part of the negotiations team with the union and the state. And since the beginning, we started asking for these benefits, not only for me, but for thousands of providers in California. And being part of the Child Care Providers United has made a real and tangible difference in my life, not just as a provider, but as a person planning for my future. Before our union won benefits, family childcare educators like me were largely in our own. We didn't have these opportunities that we have now. We poured out our hearts. Everybody here has been saying that we poured our hearts out into taking care of the children every single day without a safety net that other workers in other areas have. Family childcare providers through the nation don't have that. And so in California, when we start negotiating with the state, we want 3 different funds. So we want the healthcare fund, which gives me great pressure because when you go to the doctors, right, sometimes it doesn't cover everything. So through the care fund, it gives me access to money around, I think right now, this year is $9,500 that I can use along with my vision and my dental benefits. And that kind of coverage, it's really helpful because maybe you shouldn't know this, but for many, many years, I couldn't afford to get my dental fixed. And I'm starting little by little doing that because they give me an statement of about $9,000 to get my dental fixed. And with the benefits of the union, I will be able to start fixing it without getting the money out of my pocket, right? We're gonna get it out of the fund that we fight for it. So that's one of the things that I really am enjoying, and it's making a difference in my life. Also, we also have the training fund. This training fund has given us the opportunity to receive an ongoing money for $5,000 every year. So every year you can go back to college and receive a degree using this money that we fight for. And it's really, when I see the graduations of my peers, it's really, my heart is really happy because I was part of the negotiation, right? And seeing all of those women getting their degrees with the money that we were fighting for, it's so joyful. Also, guys, it's another benefit, a great benefit that I never thought I was gonna see. Let me tell you something else. I started the movement with the union in 2000. So I've been doing this work with the union for more than 2 decades. And so when I was starting it, when we started, the group that we started, we were thinking, okay, we want retirement. That's really, something that we need to retire with dignity. And we were fighting and fighting and fighting. And finally, when we got the chance to sit down with the state and negotiate the retirement plan, and we did it, it was so much joy. So we received this retirement from the time that you receive your license, we received money, right? So if you had, like, for example, I started in 2000, in 2001. So I have about 25 years of being a childcare provider. I will receive $427 per year until now. And then I will keep receiving that money until I retire. We're hoping on our negotiations to maybe raise it more, right? But so far that's what we have, and I'm so grateful for it because we didn't have nothing before. And so these are the three great benefits that we have received that I myself can tell you that I have been working since 2000 with other providers, and it hasn't been easy, but we did it. We did it, we have it, and we keep working right now. Today, on this moment, we're working for a rate increase. Hopefully, I can come back here to tell you that we did it and that we're getting more, more payment because we are at the 2019 level, which is not good for us. We're not even at the California minimum wage. So with that, I can tell you that these three things that had happened to us here in California is giving us the opportunity to do everything that are required to do, right? The health, the retirement, and the continuing education, which is really good. So I don't know if you guys have any questions, but that's what we have been doing.
Thank you so much, Jessica, for sharing and sharing about what it means to you personally. I am seeing there are several questions coming into the chat for you, but I'm going to ask one kind of selfishly because I am curious. We hear about big movements and big policy change happening like this. And for some of us who are kind of on the outside, where it can be a little overwhelming to hear about, how do we get there? How do we do that? How do we build momentum like that in our communities? So can you share a little bit about, I know you said you've been doing it since was it 2000? Since 2000?
2001. So these
Okay.
benefits did not come easy, right? We started in 2000 and 2001. That's when we really started the movement. We were providers getting together. We have a lot of meetings, a lot of talking, a lot of organizing, a lot of trainings. So everybody knew what we were going to do. Everybody doing the same thing, saying the same thing, going to the same vision, right? And it was not easy because not many providers believed that we were going to be able to make it. But the ones that believed that we're going to make it, we bring the other ones along. And I said, come on, you have nothing to lose. We don't have nothing, right? The only worst thing that can happen is that we get it. And so it was fun. It was fun. It was getting together, the whole state, everywhere, anytime, every opportunity, every meeting that we have an opportunity to get together and to speak about organizing. So organizing it's the key. Talking to each other, right? Set up goals, get a list of the things that you want. For us, these three things were the priorities. Our priority that has always been the priority is to raise our wages. And that is the one thing that we haven't done. But instead of getting the wages raised, we have these kind of like a fee that they give us, extra money that they give us. They call it the care cost plus. So for example, in my area, we receive $162 for each child that I have at my care. And that the function of that is to help you survive the amount of money that you have not received on your wages. But this year, we have been, since the year started, we have been working unstoppable. If you go to the CCPU Facebook page or website, would not stop. We have been doing the rate reform. We have a bill that it's asking to raise our rates. It's SB 1989, I think is the bill. If it is not the bill, while my other partners are talking, I give you the right information. But right now we're working on that bill to pass so we can get the rate reform in our wages. And I really, guys, really hope that this happened this year, because we have been waiting so long for this. So long. I don't know exactly other states, but in California, we earn $6 to 7 some cents through the state of California. And that's how providers are living. But we'll need about a handful of children to pay our assistants, to be able to make it, to be able to have some extra money to live. It is not easy. It is not easy. Some people said, well, you have like 14 kids. Yes, but we have to pay our assistants. We have to pay a lot of bills, right? A lot of overhead fees that we need to do. So it was not until 2019 that we finally got the right to form our union. And from there, that's when we started working. And for the first time, over 400,000 family childcare providers across the California had a collective voice at the bargaining table. And so if you're starting, I'm just gonna tell you, keep going, don't stop. And if they say, no, it doesn't matter, just come back and come back and come back. We have 3 governors who vetoed our bill until we got Governor Newsom to approve it, and he signed it. And then we got the right for bargaining. So don't give up.
That's so encouraging. Thank you.
Yes.
So I'm looking to see what other questions we have. Um, 1 second, I believe there was one. This one could be for anyone. But do you all, they're asking if we can have a brief conversation about what legislators are saying about salary increases, which is, I know that's kind of broad, but does anybody want to talk a little bit about legislators and salary increases for family child care educators?
So in California, we just doing the bill that I mentioned, and with the union, we went lobbying about 2 weeks ago, and most of the people are on board because they see how much money we earn, hourly. It's not even half of what Californians earn. In here is the hourly rate is $16.50. Providers earn $6 to $7, depending on the area where you live in California. It's not even half of what we're earning, right? So I think everybody is realizing that we need that increase, not only because they haven't done it since 2018, but because of the inflation and the cost of things are going up, and we are earning the same way. And if you have assistance, you need to pay the minimum rate of 16.50 cents to our assistants. So I think they're seeing right now that we really need an increase. I don't know if any other states would like to speak about that.
Well, I can just add in based on some of the conversations that I see with legislators and elected officials. So it's different across every state. That is one thing. But what I will say is it's one thing to see a story on a piece of paper or a number, a budget line item. It's another thing when you actually walk into a legislator's office or you invite them into your family child care program and you tell them, I'm living off of $5, $6 an hour, and I have to pay all of my expenses after, you know, I've been working for 50, 60 hours. I don't have enough, money to save for my child's
Maybe we got
college, or I don't have enough money to go to the doctors, time to take off, to pay somebody to come into the family child care program so that I can go and get some of my health care taken care of. When you share that story, that's what changes minds. That's where we get people to say, this isn't acceptable. I have to make sure that that number is higher because, now Miss Jessica, or Miss Irma, I see some of the people in the chat. I know what they're doing. I know what they're capable of, and I'm gonna make the difference that I can do in how I vote on something. And so I know that, Jessica, you said you went up over and over and over. You were putting a face. You were making it clear that they couldn't just ignore who you were, and that changes minds.
Yes, let me tell you, in the airport, there were legislators going to Sacramento and they already knew me. Like, oh, I know where you're going now. And then one of them, it was a very special case. We always bumped each other in the airport. And then he's like, you can visit me in the office here in Orange County. Why are you going to Sacramento? I'm like, sometimes I come to look for you in your office here in Orange County and you're not there, so I have to go to Sacramento. But we also go visit other people, not only you. So he was very funny. But they get to know you and they get to know your stories and where are you working every single day towards the change, not only for one person, for a whole community. 44,000 providers in California. You can say it easily, but it's 44,000 lives that need to be touched, need to be changed, need to live by dignity, right? And so it's easy. They told me, why you keep doing it? Why not? Why not? We have nothing to lose. The only thing that we need to do is keep going and keep trying and keep making the difference and ask for what you work, what you need. It's right. It's the right thing to do. Many of these legislators, they don't even know. We were talking about how much money we get paid for reimbursement for food for one day for one child. In California, we get about $11.20. What can you buy with $11.20 for one meal for one child here in California? Not even a Happy Meal. That costs like $15, $14, right? And they want to pay you $11 for the whole year for 6 meals. Well, actually, not 6 meals, but 3 meals and 3 snacks. Yes. So that's how you get to talk to them. Like, let's do math, simple math. And they do math with you. These people don't know exactly what's going on in your daycare, the expenses that you have, the transportation you do. You need to have a commercial liability insurance. Do you know how much it costs? Right? And they're like, no. Well, let's talk in the Google. And right there, we do the math. It's not easy. Our work is not easy to do without the right amount of money to invest in children. Because we use our cars to take the children to their home when the parents don't have a vehicle. We take them to school because the parents are working. We have to feed them because the parents are not able to do it. So we are those people that are taking for granted that we need to do all this work with the little money that we receive. And yes, we do it. There's many of us right here that we still do it. 25 years and we still do it. 45 years and we still do it.
Yep. Y'all are amazing. And you deserve to be paid that way. So we are going to wrap up the panel discussion. I know we have other questions that are still coming in. But I just want to ask the three of you, Marissa, Jessica, Mario, if you could give one quick sentence, one quick, this is what you should take away and this is what you should do. What would you say?
I think for me, just the importance of investing in educators, making sure that they have the supports that they need. They do such incredible work, and to really professionally recognize the work that they're doing. So I would say, again, just really recognizing their important work and really providing compensation and benefits that allow them and their families to thrive.
Yeah, I would say, the importance of community, I think is more important now than ever. And so, going into places like this and forums like this to learn about some of the things that are happening, being in communication with each other, and with the leadership at NAFCC, all of it's critically important. And especially during what can be a really difficult period of time where there's a lot of volatility. And so just keep showing up for one another. And again, thanks for having me.
Thank you. Thank you, Maria. All right, Jessica.
Yes. One thing that I want to say is that never accept a no. And if they say no, tell them you're welcome back next year.
I love
Every time they tell you no, you come back and you show them. Because at the end, they're going to listen.
I
Like
love
they
that.
did here in California. So just keep coming back.
Keep showing up. I love it. It's a marathon, not a sprint, is what I tell myself in this work. It's a marathon, not a sprint. All right. Well, thank you all. We are going to talk a little bit now about policy levers, and we're going to share a resource that we've put together so that you can see some of these examples that have been shared within the context of the policy levers. And I have some slides, I believe. If we can share screen again, that would be great. Thank you. Okay. So one thing that I was reminded of in this conversation is something that I learned when I first got into policy work. And that is when one person struggles, we see it as an individual issue. But when multiple people across different settings struggle with the same thing, we know that it's not a personal failure, it is a systemic failure. And systemic failures require systemic solutions. And so that's one of the reasons why we're talking about policy solutions here. These are policy failures that have created the situation that we're seeing across the nation right now. And so you all are doing essential work, and the systems that have been built around benefits were never designed with you all in mind. And so most benefits, as we know, are tied to a traditional employer, but that system doesn't work for you all in the situation, the essential work that you're providing. So we've already heard that there are some examples, and so we have put all of these together in a brief that is going to be shared in the chat, hopefully. And this brief explores policy levers that can be used to fight for change, as well as some advocacy tips that you can use at the local, state, and federal levels. So I'm going to go through I'm going to go through a few of these pretty quickly. I'm trying to go quickly, as you can tell. But please explore the brief and you can dive into it a little bit more there. So one of the policy levers that can be used for increasing access is decoupling the benefits from employment. Decoupling benefits means designing benefit systems that are not tied to a traditional employer and are accessible. We see this happening in some states. Several state paid family leave programs explicitly allow self-employed workers to opt in. We also know that these programs matter because they recognize that self-employed workers also get sick, also need time to take care of family members, and deserve economic stability. Another area is Medicaid eligibility and healthcare access. Many family child care educators experience fluctuating income, as we've heard a little bit tonight. And so policies that allow for more flexible income calculations or continuous eligibility periods can help maintain healthcare coverage. And then we can go to the next slide. So portable benefits is another strategy that can be used. Portable benefits are benefits that stay with the worker rather than being tied to the employer. The concept is important for independent workers, gig workers, self-employed professionals, such as family child care educators. One of the things that we're seeing is this through retirement programs. That's one example that's gaining attention right now through programs like Oregon Saves and Illinois Secure Choice. These programs were originally designed to help workers without employer-sponsored retirement plans so that they could save for retirement through automatic payroll deductions. And now some states allow self-employed workers to also participate through payroll deductions voluntarily if they want to do that. And then some states are also exploring matching their contributions for lower income workers, which is important because access alone isn't enough if people can't afford to participate. And this idea of affordability is critical across all benefit systems. We often talk about access as if it's simply making a program available solves the problem, but we know that that doesn't. Because if premiums, contributions, or out-of-pocket costs are too high, then access is not meaningful. And so that's why income responsive support is another important policy lever. Solutions like sliding scale, healthcare subsidies, tiered paid leave contributions, and state retirement matching programs is important. The next slide talks about what Jessica has shared so much. The importance of collective models or collective and pooled models. Individually, family child care educators have limited bargaining power, but together you all can negotiate for better rates, build shared systems, and advocate more effectively for public investment. The Child Care Providers United in California is a powerful example of how they have secured healthcare stipends and retirement contributions. And let's see the next slide. So policymakers should invest in infrastructure as well. So having access to it is one thing, being able to afford it is another, but then still being able to utilize it and use it is important. And so funding enrollment support, technical assistance, outreach is another policy lever that could be considered. Navigating complicated benefit systems, tax forms, healthcare marketplaces, or retirement enrollment processes is overwhelming. And so organizations like NAFCC and local family child care networks can really help to bridge the gap between policy and practice. So navigator programs, technical assistance, community-based outreach can help make sure that family child care educators are not left alone to figure these systems out. And before I turn it over to Francia to close us out and share some important information about NAFCC, I just want to take a personal opportunity to emphasize what I feel is essential in this moment. And that is that family child care educators have been carrying the child care system for decades, despite chronic underinvestment and exclusion from traditional benefit systems. And once again, the issue is not that educators are failing to plan for retirement or failing to access healthcare. The issue is that the systems themselves were not built to support you. However, systems can be redesigned. And so remembering that we already have examples of policies that can move us in the right direction. We already know that the solutions exist. What is needed now, more than anything, is the political will to make the change. And that's where your voices and your advocacy come in. Your lived experience is incredibly valuable and helpful in moving in the right direction. Your experience is expertise. And when policymakers hear directly from you about what it means to operate without paid leave, to worry about retirement after decades of service, or to struggle with healthcare costs while providing essential care to families, it changes the conversation. And so the policy team at NAFCC is committed to elevating your stories. We are committed to pushing for policies that work for you. And we will continue to demand systems that recognize your work, sustain your businesses, and support your long-term well-being. Because we know, and trust me, I know, because I have a child in family child care. I know that it is only when you all are well that children, families, and communities can also be well. And so with that, I'm going to turn it over to Francia. Thank you all.
Thank you so much, Daphne, and thank you everybody for being here. I just want to take a moment to honor you and celebrate you. What a wonderful presentation from our policy team. And I know we're almost home stretch, but here we want to put this policy into action. And in this part, I just want to share with you how our efforts are supporting this part. So before we close today, and I'm sending you everybody virtual chocolate in here, so bear with me for a few more minutes. So if you can please drop one word in the chat that describe how are you feeling leaving today this webinar. Let's check it up, and if you can share how are we leaving this webinar today. Maybe we can bring a couple words aloud. Hopeful, yes, this was very hopeful. And hopeful times a million. Encouraged, supported, helpful. That's wonderful to hear. Hopeful, seen, optimistic, inspire, understood, supported, grateful. All of this is giving me chills. It's so great to know that we're all collectively here, feel inspired, understood. Thank you so much for sharing these remarks. We can make a wonderful wordle in here. So in here, we're going to share at NAFCC, we know that policy matters, right? This is the work we've been doing in here because policy impacts our lives and real people. So behind every policy conversation is a family childcare educator trying to build a sustainable business, support families, care for children, and create a life with dignity and stability. So this is why our work here at NAFCC focuses not only on advocacy and also supports direct support for the educators. So we have in our membership department support to our community. We're focusing on wellness, retirement support, business support, professional support, leadership opportunities, community and networking. So here we work with data, and in membership we're intentionally designing and working our benefits around the realities of family childcare educators in benefits that are built specifically for this field. So I just want to just mention a few of them. This information is available in our website, but we just want you to know that we have a partnership with Stride. This is a healthcare navigator. As we are talking, some of the family childcare educators may qualify for Medicare, but if that's not enough, you can join, and through our healthcare navigator, is part of the Affordable Care Act, and you will be able to shop for your vision, dental, and health insurance all in one. So the other piece of this is we are so excited to be starting this year a partnership with Bestwell and having on retirement benefits. As we know, we know in here that we believe that people who spend their lives caring for children and supporting families deserve an opportunity to age with dignity, stability, and peace of mind in the golden years, right? So through these past 3 years, we heard loudly and clear that educators across the country were saying that retirement and long-term financial security was one of the greatest needs in the field. So this is why we have been proud to now have a partnership that offers a multiple employer aggregation program, also called MEAP, and it's a retirement benefit. You come here, you pay that one-time fee, and then you are able to have access to a retirement account and have your administrative tasks more centralized and still have flexibility to design your own retirement plan. So you can find more information about this on the website, as well as our dental insurance. We have also a partnership with Renaissance, and our family childcare educators are able to access dental coverage. It has a robust network throughout the nation. Other opportunities we have here is through our professional development opportunities and having high quality learning with different language access and national connections. So we are working with various partners to offer a business series of family childcare so we can support strengthening your business. This past fall, we kick off childcare business accelerator, which we call Empower Her. And this was able to bring some opportunities to do a deep dive into business opportunities and having the childcare educators earning some stipends as they are learning through this program. And as well as our live and on-demand professional development opportunities available. Also, we are able to have now a tax coach on site who has been, she goes through extensive training, and every year she has to be certified that she's able to provide these opportunities for business support. And so Violeta is our coach support. You can call her through our membership at nafcc.org, and she can meet with you one-on-one. And she's able to ensure that, all your tax questions around your business can be addressed. Other things we have here in our membership is the many leadership opportunities. In here tonight, you can see many of our state representative ambassadors who are doing a tremendous amount of work advocating nationally and in their own states to move and shake and, through many initiatives. And they are getting proclamations, recognitions for family child care. They are working to build associations. They are working to be advocates and to help the field to be seen and have understanding of our work. We work with various state associations and affiliate partners to expand the work and to be stronger together. And other pieces that you can enjoy here in our membership is like these sessions tonight through our policy webinars, virtual learning, coming to our national conference. As a member, you get great discounts and great access to our regional and national conferences. And also we host 6 different caucuses, Black, Hispanic, Arabic, Indigenous, Asian American and Pacific Islander, and military caucuses. And again, through the leadership community, we also have advocacy, mentorship, and leadership opportunities through our fellowship, Leadership in Leaders, through our policy fellows. And so we have many opportunities here for our family child care educators to help lead the field and to help grow and to help build in this community together. So, so we're excited to be able to offer this. So, if you are not yet a member, let me see what slide we're on. If you can put, thank you. This is, can you please, we have, yes. So please, if you are not a member yet, we invite you to join our network and membership. And if you are a member, maybe you also can share in the chat what has been a great thing you have enjoyed in your membership benefits from NAFCC, and that would be great. So please share widely with your networks, with your communities, in your social medias. And again, we're building a strong network. So, united together, we can reach farther and stay stronger. So thank you so much for being here. And we hope to see you around these forums. And please call us if you need any support with your membership. Thank you so much.
All right, thank you all. We appreciate it. Thank you for being here. Anybody who is interested in our policy updates, you can scan this QR code and make sure you're getting our updates. And then I believe our contact information is on the next slide. Maybe? Yes? This is the policy team. You can find us at these email addresses, and we hope you all have a wonderful night, and we'll see you next time. Thank you all.
Thank you. Thank you to all the presenters. Thank you to Daphne for an amazing webinar. Good night, everyone.
Thank you.
Thank you.